First of all, I have to be fine with myself. I have to accept myself, and then I will accept everything that is around. During their life, it's the high effect that many people would be diagnosed with cancer. So we are aiming high to know whatever we have to do, working with government, with private initiative, with all the people that are involved in the cancer matter.
Cancer doesn't mean it's the end. It's not the death. That's giving hope. And when you see your friends going through certain situations, you give yourself this hope first.
Speaking of Hope, Support, Heal, Season 2.
Hello and welcome to Speaking Of, a podcast brought to you by Axios International, and I'm your host, Sudashini Christopher. The Speaking Of podcast gives individuals a platform to share their insights, perspectives, and stories of encouragement with those facing similar struggles in their journey toward hope, support, and healing. In Season 2, we have been featuring stories of resilience and initiatives addressing healthcare access challenges from key thought leaders and change makers who also share their personal patient or caregiver experiences. Most importantly, the common thread connecting us all is a sharing of stories of hope, support, and healing. In this episode, we are honored and delighted to have Francisco Frayeria, CEO and General Director of FUTEJE. FUTEJE supports people with scarce resources and without any type of social security who suffer from gastric or colorectal cancer and promotes a culture of prevention and timely detection. It is the only institution in Mexico dedicated to comprehensively supporting this type of diseases. Francisco is also a founding member of the national movement Together Against Cancer, which aims also to cover the largest and most inclusive national movement that brings people together to improve the cancer environment in Mexico. His list of achievements is quite extensive. But instead of listing them all at once, let's get to know Francisco better in our conversation. Hello, Francisco. How are you doing?
Hi, Sudashini. It's a pleasure, and I'm honored to be here with you, participating in this very important podcast. To bring to the table the things that we are doing with different people in different countries and different organizations. And I celebrate with you this season 2.
Thank you, Francisco. A pleasure as well. So first and foremost, thank you so much for accepting our invitation to be here. So let's deep dive into our conversation. When you were a young Francisco, did you ever imagine you would be where you are today? And how you found your way into the healthcare field? Tell us more about that.
I never had a clue, but I will come to this part of on health or on the health system, or working with patients or with people with different kind of needs. I always imagined that I could be an architect or another profession, but not to be and less also in the foundation, in civil society, or working, for people in need or whatever. So because of a personal experience, when I was a very young kid, I get into this world of alcoholism and drug addiction. I stuck there. There were times that were very difficult for me. Also with my family, with my parents, my brothers, all the people that were around me. And when I had 24 years, I decided to ask for help. So I went to rehab, to a specialized center. So when I was ready to go out to face the real world without any substance or consumption of alcohol or drugs, I realized that I started to giving my testimony and trying to help other people that were suffering for the same disease that it's alcoholism or addiction. And I started to give these testimonies because through the AA program, I started, to give the message, a way to help others in the same situation. And that take me to other actions. And I ended, working in some other institutions, other foundations, always related to health and to bring up, like this hope for people that there can be a change if you propose it, if you want it, if you really do the things that you have to do and stay out of trouble, out of problems, to love yourself, to care about yourself. And for me, that's the best way to care for others. Because, first of all, I have to be fine with myself. I have to accept myself. And then I will accept everything that is around me. Situations, persons, whatever it comes, I'm going to be able to handle all that, and especially myself.
Yeah, I think we all go through that kind of moments one way or the other, right? And it's very interesting how you overcome those moments. It's different. Journey is different to everyone, but it's all about what are you going to do about the scenario or the situation you are in, right? So you decided to come into healthcare and widen your scope, and also move into civil society work. Not just the topics that you just said, right? So not just around like alcoholism or drug addiction. You are also leading so many initiatives for cancer patients, especially through civil society work. So how did you discover the passion for this particular work that you're doing?
Well, this part of the alcoholism and drug addiction and everything, when I had some years in recovery, one thing was leading me to other. So when I was working at one company that have health matters, health programs and everything, they wanted to create a foundation to be, for giving support for people with no resources on orthopedical issues and different type of helps or programs. And because of that trajectory that I had on the addictions and all of this, they asked me that if I could create these foundations. So I turned into it. I create this foundation. They named me the president. Well, now I'm the former president of that foundation. And for some years, we gave support to these communities, to these people that, they didn't have access to health system, or they have, some issues with orthopedical matters. We also bring some other programs of education. And, from since then, I started to realize how good it was for me, to be doing those things, all the satisfactions, all the like the rewards, all the things that I have because of it. And I saw also that I can be able, or I was being able, with all the support that I was having, to make a change in the people with more necessities in Mexico, and to put like this part of me on giving back what sometimes some people give me to be out of where I was, going through. So I decided to part of my time, part of my work and everything, to be dedicated to the third sector, as we said here in Mexico, to work, as a volunteer, or to be a president, director, or whatever. It wasn't about the title of the what, because I just wanted to help.
So how do you see the things around currently in Mexico's health system, especially supporting people who are facing similar situations. How do you foresee transformative changes, particularly for cancer patients?
Well, after 32 years of being, working in foundations, helping other people and everything, the health system in Mexico, it's a fragmented system. It works in different ways. They don't communicate one system with the other. And as I said, systems is because you have like the National Institute of your Social Security, then you have kind of social security for the employees, but it's the ones that work for the government. Then you have like the Ministry of Health, and from there they go down to different sub-health systems. Then you have the Marines, you have the military, you have it's a very complicated and fragmented system. And there are people that the ones that do not have access to social security because they don't work formally in a company or whatever. The things with the government that they have been trying to put out different models of attention or different systems, but they haven't still worked at this time. Now they're working on the thing that is called IMSS Bienestar, that it's the one that it's going to be giving support and attention and everything for the people that does not have IMSS, okay, that is the Social Security. So we have been working side by side with some people from government, senators, and people from different, from the different chambers, to build a very important program that it's like the national cancer law in Mexico. Because at this time we don't have a national program of cancer, we don't have a national register, we have lack of access to medicine and some things, for treatments and access sometimes to hospitals, and it's very complicated. But we are like trying to go by hand to see how we can create, how we can work on these matters. We are part as FUTEJE of the commission it's like the commission of civil society to create or to impulse the creation of the the general cancer law in Mexico. So we are 13 organizations that work with different types of cancers. We all together, we are, all the experience that we have, all the time that we have been working, it's more than 150 years, almost 200 years on work. If you put together the time that they were that they started the work and everything. So we have been working with academics, with different lawyers, with people that know about budgets and all the things that are needed to put the law of running, and also by the hand of different senators of the different parties that are in Mexico, because now cancer it's a national health problem. Not just in Mexico, worldwide, it's a very important matter that we have to look at it. And so some of these senators that are, working with us, some of them have very close experiences with cancer. Some of them are survivors from cancer. So they know what we are talking about, and especially they know what are the needs in Mexico in order to have this national cancer law. We hope that things can change in a better way. So all the people that are diagnosed or to be diagnosed, because that many people during their life it's very high expectations that many people would be diagnosed with cancer. So we are like aiming high to do whatever we have to do, working with government, with private initiative, with all the people that are involved in the cancer matter. So in a few years, I hope not so many, we could have a general cancer like Mexico and all that what it would bring to Mexico.
You brought a very unique perspective, especially when you talked about civil society work commission, and you're calling it the entire process of how social societies operate, viewing them more as a commission rather than traditional organization. So can you explain a bit more of your viewpoint here? Does it bring efficient working ways when you collaborate with other associations and partners? Why is it so special?
Yes, definitely. In FUTEJE and myself, we are convinced that making alliances with other people, organizations, with government, like the collaborative work between organizations and all the people involved in the things that you are aiming to get. It's very important. As FUTEJE, we are also part of the Global Compact from the United Nations, and we are aligned also to the SDGs. So we are convinced, and the SDG 17, it talks about alliances and this collaborative work. So we are convinced, and we have seen through the years that working together have demonstrated to everyone that there's transparency, that there are no, in this part of the civil society working together for this, looking for this, the general council law, that there are, we all work together, we all understand, we have the same objectives, we have the same vision, we have the same perspectives, and we are all aligned on what we have to do. There are not anyone that it's a protagonist or to want to show off more or whatever. No, it's because it's a very important need in Mexico. It's a law. It's all the directions that we can take with a law, because it's going to be easier for people to navigate on the system, to get access to treatment, to get access to hospitals, to get access to palliative care, to get access to whatever they need on their journey through cancer. And also putting on the table the importance of the early detection programs, and also to have all these education on the, we call it here in Mexico, it's like the first contact doctors, because there's a lack of education in these doctors about the reference and contra reference, as we said in Mexico, for a second level, okay, so the people can be maybe have a early diagnosis, because so many times in cancer there are about 70 or 80% cases of all cancers that come on advanced stages, because they don't have an early detection or an early diagnosis or correct diagnosis. For example, in colorectal cancer, usually the doctor said, "Oh, you have colitis." Okay, the thing is that the symptoms are the same as the colorectal cancer, and the people are stuck there, having some prescriptions and medicine, or medicines that you can have over the counter. The people don't go anymore to the doctor because it's time, it's money, it's whatever. They have these medicines on in the bathroom, or their first aid kit. So any time when they feel bad, they take the pill, and it's a relief. But you are taking care of the problem from its roots. And also, there are cases in colorectal cancer when people can come with a bleeding, when they go to the bathroom and there's a bleeding, and most of these doctors would say, "Oh, it's you have hemorrhoids. You can have this pill or put this cream or whatever," and they don't even take a look at the patient. And the access to specialized studies as a colonoscopy or other type of studies are so expensive that the people would not have the money to get into. So this will bring to Mexico lots of changes, because we are trying, in some of parts of the law, in some of the articles of the law and everything, that the early detection, that the correct diagnose at the correct time would be, it's going to be less expense, and it's going to change lots of things in the cancer, how cancer have been doing in Mexico at this time.
You also brought a valid point on how you help patients navigate the system. So, tell us more about how you engage with patients in FUTEJE, and how does the support system work around them?
Well, talking about these alliances is very important, because we, from many years now, we have these alliances with the most important public hospitals in Mexico. So aligning to several, alignments that the patients need to have in order to be eligible for FUTEJE. We have signed these alliances with these hospitals, so they refer patients that don't have that access, or don't have the money, or don't have access to the treatments. So FUTEJE, from FUTEJE and the different programs that we have, we give them different types of support. For example, we call it the PI. The PI, it's the integral support program, that it consists of giving to the patients their chemos, also their colonostomy bags. We give them all the emotional and psychological support, and also the nutritional. That's one of our main programs. We also have another one that is for awareness and prevention and early detection, that we go to companies, we go to communities, to everywhere that they open the door. We go with special, with doctors, oncologists, and everything, that give these chats about what is the disease, their symptoms, their risk factors, everything. And they go also with survival patients, but patients of FUTEJE that are survivors, that they gave away their testimony. So that's when people on this program, people identifies with some symptoms, with some things, and they raise their hand to say, hey, what can I do to see if I have any risk or not? So for 7 years now, we have been working with the INCAN. The INCAN is the National Institute of Cancer in Mexico. We are together working in the program that is the early detection program for colorectal cancer. That it's done by a screening program with the FIT test, that it looks for blood in your fecal material. Okay, so it's a test that it's not invasive. That now it works in so many countries in Europe, in the United States, and in other continents. It's a very highly and very specific test, because if it's their human blood on the fecal material, it will find it. So with this, you can diagnose if there's not a cancer, but you can see if there's if you're bleeding or not when you go to the bathroom. There's anything wrong in your, inside of you. So this test, the lead test, we give it away for free. We don't charge for it. And the most important thing is that people that have a positive result for bleeding, they are referred to the INCAN, not to the National Institute of Cancer. So with a very low cost, they can have a colonoscopy to see, what's the reason, or the thing that they could have because of why they are bleeding. So they will pay a very accessible amount for the colonoscopy. And if they are diagnosed with for example, with polyps, they're going to be a polycectomy, and they're going to, they're going to take out the polyps, and they're going to send it to a biopsy or whatever. Then they're going to tell the person that he have to come in so many 1, 3, or 5 years to check again. If there's a positive result for cancer, and if the person does not have social security, it's an automatic pass to be attended at the income, to give, to receive all the treatment, all the things that they need. And if the people have, or the person have social security, they will give the referral paper, so they can go to the IMSS to take care with a early diagnosis, and also, to this is shortening the time for a detection, maybe up to 1 year.
So you must have been part of so many stories in that 3 decades of experience, also with all this work that you've been doing. Are there any moments from serving patients that stand out to you, like close to your heart?
Yes, I am very committed to the cancer scenario, or the cancer theme. I don't know how to call it, because unfortunately I have lost so many friends because of cancer. I can tell you of very close friends. There are 4 or 5 that died from cancer. 3 of them from pancreatic cancer, that it's very aggressive. A brother of mine had leukemia, so he's a survivor now. So from then also, I was like very committed to do more, or try to do more actions for people diagnosed with cancer, and to try to make a change. That's why I am really, trying to learn more about it. I'm trying to know or understand more the patients every day, and doing all this advocacy, doing all these, I've been very blessed because I've had the opportunity to be in international forums, working with patient organizations, building programs and things to be put out, for the patients, to let them know how to navigate in this health systems, and how to empower them to make their rights come true, not just to be, on a paper or in a poster in a hospital on a wall. So really to be these patient rights to be completed and to be used, so they can be, have a good attention, that have a better health system, and also to have more opportunities. Because the word cancer, it's not a symbol of death. Many people things that talking about cancer means death, and not in all cases. All types of cancer, early detected and with the right diagnosis, could be curable. So that's very important to know. So all the things that we can do in awareness, in education, and creating laws or making public policies, working together with other organizations that have the same philosophy and want to do a change for a better world, for a better Mexico, for better persons. That's where you're gonna find.
That's very deep. What you just said, cancer doesn't mean it's the end, it's not the death. And that's exactly giving hope. That's giving hope. And when you see your friends going through certain situations, you give yourself this hope first. And you be an instrument to give that hope to the people around you, to the families, the caregivers, and so on and so forth. I think this is exactly why I think you are doing so much of work around disease awareness and education. And you have a very innovative approach to doing that as well. You make it very interesting and entertaining as well. So tell us more about some of these innovative initiatives you worked on in this area, because I mean it's always good to kind of like learn from each other, and then people who are listening to your podcast can also take some inspiration away from you.
Well, I'm convinced that we can be a better persons every day. It depends on how you see things, what you think, what you said, what you do. It's all aligned. It's all the same. And to be transparent, to really, I'm convinced when you put your heart, your soul, and all your wishes into something, you can accomplish them. So when I always said, I'm very fortunate, I'm blessed, I feel blessed because I do what I like the most, and I get paid for it. I don't know how many people, how many persons in their jobs, in what they do every day, can say the same. So I really feel blessed. And also, and especially when you see the families, the wife or the husband, the sons, the siblings or whatever, their faces when they come to you and say, thank you, because I didn't have any hope, as you said before, that my relative, my mother, my father, my kid, whatever, it's going to be able to get to be a survivor or to have any chances or possibilities. Because if FUTEJE weren't there and if all you FUTEJE team didn't give us all this support and shows how to go through it, it would be impossible because we don't have the resources, we don't know how to do it. So, as FUTEJE and as all of the organizations worldwide that are working with patients, it doesn't matter if it's cancer or if it's whatever it is, there is a very reliable and very important work that we are doing all around the world. So I encourage people, to always like see where do you want or where do you like to help, to give a hand. It's not always about money. Sometimes you can give your time. You can work as a volunteer. Sometimes we receive, donations, but it's not just about money. And sometimes just to give a hug to someone, you could change their day. So I encourage people, to look the what moves you, and if it really does, try to give you support to that organization. Any way you can, with money, with your time, with a donation, or whatever, it will make you feel better. Believe me. And when you give, you receive more than what you give.
Yes, and I think that's how you are blessed, and you are a blessing for others as well, because you rally around people around this work, the cause, the good work that you do. So let's go a couple of years back, maybe around like 4 years back. We all faced a pandemic. So how effective were the support programs for patients during the pandemic? And do you think we are prepared? Are we prepared for a similar situation in the future?
Oof, it's a hard question. Well, it took us for surprise to everyone, and it was really hard for FUTEJE because we can give away our programs because of the donations we receive, everything, and because of this situation that everyone's locked up in their houses, companies closed, restaurants closed. So some of the good people that are donators for FUTEJE, they call us and say, hey, I have to pay rent, I have to pay, the salary of my employees, and I have closed my factory, my everything because they're not working, the restaurant is closed or whatever. So it was understandable for everyone. So that represents that at that time have we with the money that we couldn't receive because of these donations, it represented about 206,000 people that wouldn't be able to have any support from FUTEJE. Especially on treatment, there were 14 people that we wouldn't be able to manage to pay for the treatments. And cancer does not stop because of the pandemic, or they don't care. You can stop your treatments. So we were very concerned about that because we're talking about Mexican pesos. It were around $1 million that we were short, that we needed to fundraise so we can pay the treatment for all the people that we yearly we support. So I came with the idea here in Mexico and in some countries in Latam. There's events that some companies or TV stations do, that it's a Teleton, okay? That it's many hours of transmission with, singers or groups and, testimony of patients, blah, blah, blah. So I came with the idea that I have to do the same. I have to do my Teleton. I call it colorectal because it was patients for colorectal cancer. We transmitted on our Facebook page and also in YouTube. And this event was for, to raising this money. We were really, really amazed because we managed to raise that $1 million. The next year, same thing. The event lasts about 7 hours and a half. We have several, artists and groups and people from the, in Mexico, one of the main sports is football, soccer. So I have, players that came and give the testimony or talk about. We have, many, many things. It wasn't like a medical or clinical event. So we raised the money that we were short, and we managed to give the treatment for these patients, and we, oof, we pass it through. And in Mexico, for example, I believe we start late on taking action. I am sure that with the experience we have and the many people that died because of the pandemic, I believe, and I'm sure that now the health institutions are going to work faster if we are in another situation, much like. And I believe that, no one could be 100% prepared, but we have our lesson.
Mm-hmm. We have learned our lessons. Yes, that's a hopeful way of looking at it towards the future. So you mentioned that you did some events, kind of like, what was that, telethon?
What's colorectal? Yes. Well, for 3 years now, we have been also doing this race for 5 and 10K for patients and people that like to run. And well, we timely we do different type of events to to fundraising and to support our programs. So we are like always trying to manage how to support all the expenses of the programs and all the things that we do at FUTEJE. And also we have international donations sometimes, and these have bring us to different alliance also. We are part of the Global Colon Alliance, Global Colon Association from the United States, that is worldwide known, and we are part of it. We are also part of the WPA, that is the World Patient Associations. We are also allies with Digestive Cancers Europe. In the past May, I went to the POF, it's a Patient Engagement Open Forum that took place in Ravenna, Italy. I was the only, we were the only institution or person from LATAM invited to this very, very important event. So, we have been expanded, FUTEJE to other continents, to other countries. We have the opportunity to show our programs, our models of attention, all the things that we are doing in Mexico that now they're starting to be useful for other countries on how are we managing to do things in our programs in this crowdfunding events or things that we are doing. And well, what we want to do is, to give this message away, to be able to show other people, to inspire other organizations that, the sky is the limit. Everything is possible when you have, all these needs, and when you are convinced on that what you are doing is right, and when you look back and you see all the people that you have touched, that you have benefited, all the things that you have been, constructing and changing, it's very, very. I don't have to express it, the
Heartwarming,
feeling.
even like, yeah,
Yes,
you
yes,
are,
the
yeah,
the feeling that.
that's a good feeling. Yeah, that's a good
Mhm.
feeling for a, and yeah, and it's touching many people's lives, has how it has touched you. So I know you mentioned a couple of initiatives that you've been doing. Was Together Against Cancer movement, was that also part of it? How, tell us more about how it has received recognition or supported by other associations in Mexico, and any future plans to take this movement globally.
Yes, you're right. Together Against Cancer in Mexico was created in 2018. FUTEJE with four more organizations, different types of cancer, we came together and created movement, to put up front all the things related to the patients, to give them the empowerment, advocacy, because many times we are invited to all types of events from pharmaceutical companies, from the government and everything, the decision makers also, but we are invited. And when you see or look around, you always ask, and where are the patients? There are the ones that are suffering. There are the ones that, in first hand, they have all the things that they need, and there's no one to represent them. So here we are. No, here are all these organizations. So we created this movement, to empower the patients. So for now, every day, even in the pandemic, we went virtual, but now everything has been in person. We have been making these congresses, and these congresses every year we take it in two ways. One that is for the different civil associations all around Mexico. Now we are in more than 28 or 32 states in Mexico. There are about 70 different associations from different states, because in the beginnings, people that work not in Mexico City but in different states, they didn't know really how to manage or how to do these policies, or to work with government. It was complicated for them. So we have, like try to give them the line of work. So how to be easy to work with governments, how to do things in their hometown states, and everything. And also in the last years, we have managed to the movement to be in Latin. So with participation of countries from Argentina, Brazil, and other countries in Latin that also have their Together Against Cancer movement. So, to copy or to learn from the ones that have more experience, so we can bring things to Mexico and put it, up to work. And also for our own countries to learn about what we are doing in Mexico, so they can replicate in their countries if it works for them. So it has been a very interesting thing, to work with patients and everything. And in these congresses, also there's the part for the patients, because patients are invited also, from different types. So well, there's always, different type of like these tables, with different types of doctors or specialists and everything, that gave like these chats and everything, so they can empower the patients.
Thank you. That was like a really interesting conversation, and also so many details, so many stories. Are there any thoughts or closing moments you would like to give to your listeners?
Well, that to give away this message again, that together we can make the change. If you are really committed to, if you really put your heart and soul to do the things that can make a better world, that you can give hope and change the opportunities for people that don't have them. And if you can put, something into it, it's gonna be more. You're gonna be more rewarded that you can expect. So I believe that together we can make the change. That together we can create a better world.
Thank you, Francisco. So, with Francisco Freyeria's closing thoughts, speaking of Axios International Podcast, Hope, Support, and Healing, this episode comes to an end. Until we meet you in the next episode. See you.
Axios, transforming access to healthcare.